Hello, it's Dr. Rhonda Johnson. Today is Saturday, November 12th, 2022. Today I'm going to be talking about a newly published report from the CDC. Well, folks, yesterday the CDC released in their weekly Morbidity and Mortality journal a report which looked at hospitalizations associated with COVID-19 and babies 6 months and younger. So they examined data during the time period that corresponded to the Delta wave, the Omicron BA1 wave, the Omicron BA2 wave, and the Omicron BA5 wave. And that was from June 20th, 2021 to August 31st, 2022. And what they found was that during the Omicron BA2 to BA5 dominant period, the weekly hospitalization rate among infants less than 6 months of age increased 11-fold. Now, according to the CDC, hospitalizations for babies under 6 months was higher than rates in all other pediatric age groups and adult age groups under 65. And the hospitalization rate for babies under 6 months for COVID was similar to adults ages 65 years and older. And folks, that is just not good news, no matter how you look at it. Now, associated risk factors for the babies were infection in the mother at the time of delivery and a history of prematurity. Now, the data found that among infants who tested positive for COVID during the birth hospitalization, the majority had no symptoms. And also for these babies, severe hospitalization outcomes, such as needing to be on assisted ventilation support, were very low, and deaths in babies under 6 months of age were less than 1%. Now, the report did not capture the COVID vaccination status of the mother or history of prior infection. So what are some key takeaway messages here? Number one is that babies under 6 months of age had the highest rate of hospitalization from COVID in the United States, second only to the 65 and up group during the Omicron BA2 to BA5 wave. Now, the CDC report recommended that to help protect both pregnant women and infants who are too young to be vaccinated, prevention methods should focus on ensuring that pregnant women stay up to date on their COVID-19 vaccines, including receiving a bivalent booster dose, and families with young infants should implement non-pharmaceutical interventions to prevent COVID-19. Now, this is my point, just as a reminder, you can't mask babies and children under 2. And, if you think about it, if you have a baby that's under 6 months of age, you may want to be careful where you take them. You may want to avoid indoor, crowded, poorly ventilated places where people aren't masked up. And also make sure there's adequate ventilation. Like with the holidays coming up, somebody should have a window or a patio door or something cracked open to let some air circulate, or have a HEPA air filter, HEPA, to protect the baby's air that they breathe in. Now, we have to remember that a baby's immune system is not fully developed when they are born. It gets stronger as the baby gets older, and we are in the midst of a triple-demic of RSV, COVID, and flu, plus the usual common cold viruses and enteric viruses. So try to make sure your babies are protected. That's my message today. I'll include the link to the CDC report in for you. Thank you, and be careful.